Did you know that Lewy body dementia, or LBD, is the second most common form of dementia after Alzheimer's? Yet many people have never even heard of it. It's a difficult disease to recognize. Its symptoms mimic several other conditions: Parkinson's, Alzheimer's, and even certain psychiatric disorders. But why is this so important? LBD develops gradually, and the sooner it's detected, the better the chances of slowing its progression. The early warning signs can be easy to overlook, often mistaken for normal aging or simple forgetfulness. Hi, I'm Dr. Ethan Hale. In this video, we'll break down what Lewy body dementia is, why it happens, and what early symptoms can give it away. We'll discuss how it's diagnosed, the available treatment options, and the best ways to care for someone with LBD. We'll also talk about how to support a loved one with LBD and share practical strategies to help make life easier for them. Stick around until the end. This information could be life-changing. If you find this topic interesting, please give this video a like, and let's get started. By now, you already know that Lewy body dementia is one of the most common forms of dementia. But what exactly does this diagnosis mean? Let's break it down. Lewy body dementia, or LBD, is a neurodegenerative disease that gradually impairs memory, thinking, and motor functions. However, unlike Alzheimer's, which primarily affects memory first, LBD often presents with hallucinations and movement issues early on. On the other hand, Parkinson's disease is also known for movement problems, tremors, stiffness, and slowed motions. But with Lewy body dementia, these symptoms come along with cognitive decline and disruptions in perception. The main cause of LBD is the buildup of abnormal proteins in the brain, known as Lewy bodies. These proteins accumulate inside nerve cells, disrupting their function and eventually causing them to die. This affects the brain regions responsible for thinking, memory, and movement. So in a way, LBD combines features of both Alzheimer's and Parkinson's, but it also has its own distinct characteristics. Next, we'll explore why these protein deposits form in some people and what factors might increase the risk of developing LBD. We already know that Lewy body dementia develops due to the accumulation of abnormal proteins inside nerve cells. But why do some people develop these protein buildups, while others don't? One of the main factors is age. LBD is most commonly diagnosed in people over 60. The older a person gets, the higher the risk of brain function decline, which can contribute to the disease. There's also a genetic component. Although LBD is rarely inherited, research shows that people with a family history of Parkinson's or Alzheimer's have a higher risk of developing it. Some individuals with Parkinson's disease eventually experience cognitive decline that closely resembles LBD. This happens because both conditions involve similar processes of nerve cell degeneration in the brain. Here's an interesting fact. Men are more likely to develop LBD than women. The exact reasons are still being studied. But one theory suggests that hormonal differences and immune system factors may help protect the female brain from the disease. So factors like age, genetics, and pre-existing neurological conditions all increase the risk of LBD. But how can you tell when the disease has started to take hold? Let's talk about the early symptoms and what signs you should be looking out for. We already know that Lewy body dementia develops due to damage to nerve cells in the brain. But how does this affect a person's daily life? The first noticeable changes involve cognitive function. People may struggle with attention, experience confusion, and have difficulty with planning and logical thinking. Unlike Alzheimer's, memory can remain relatively intact in the early stages, but it gradually declines over time. A key hallmark of LBD is hallucinations. People may see or hear things that aren't there, most commonly images of people, animals, or strange shadows. Sometimes, they realize these hallucinations aren't real, but in other cases, they perceive them as part of reality. Sleep disturbances are another warning sign. A person might talk in their sleep, flail their arms, or even get out of bed, as if acting out a dream. This condition is known as REM sleep behavior disorder. Over time, movement problems appear: stiffness, slowness, hand tremors, and balance issues. These symptoms resemble Parkinson's disease, but in LBD, they develop alongside cognitive decline. Emotional changes are also common. A person may become anxious, irritable, or on the other hand, indifferent to what's happening around them. Depression and severe apathy are frequently seen. The The combination of these symptoms makes LBD particularly challenging to diagnose. Next, we'll break down how the disease progresses and the different stages it goes through. Lewy body dementia progresses gradually, and symptoms vary at different stages. Understanding these stages can help detect the disease early and prepare for the changes ahead for both the person affected and their loved ones. In the early stage, signs often go unnoticed. A person may seem absent-minded or experience brief episodes of confusion. Their attention may fluctuate. One day they're alert and engaged, and the next they seem withdrawn and forgetful. Early hallucinations might seem harmless, and sleep disturbances may be dismissed as random occurrences. At this point, movement symptoms are minimal. The middle stage is when the disease becomes more apparent. Memory declines further, and confusion becomes more frequent. Hallucinations may become distressing or trigger anxiety. Motor symptoms worsen. Balance issues, slowed movements, and an increased risk of falls become more prominent. The person may forget how to perform everyday tasks, like getting dressed or using household appliances. In the late stage, full dependency on caregivers sets in. The person may lose awareness of their surroundings and fail to recognize family members. Speech becomes slurred and may eventually disappear altogether. Severe movement impairments make walking and even sitting up impossible. Swallowing difficulties increase the risk of pneumonia. At this point, the person is bedridden and requires around-the-clock care. Each stage of LBD requires a unique approach to care and support. Next, we'll explore how modern diagnostic methods help identify LBD early and distinguish it from other conditions. We already know that Lewy body dementia often resembles other conditions like Alzheimer's or Parkinson's. That's why diagnosing it is a complex, multi-step process. It's important to consider not just individual symptoms, but how they appear together. The first step is a clinical evaluation. The doctor talks to the patient and their family about when the changes started, what symptoms have appeared, and how often episodes of confusion occur. Special attention is given to hallucinations, sleep disturbances, and movement issues, key signs of LBD. Next, neuropsychological tests are used to assess memory, attention, and thinking speed. Interestingly, Alzheimer's patients typically struggle more with short-term memory loss. But with LBD, attention fluctuations and difficulties with problem-solving are more common. To rule out other possible causes, lab tests are performed. For example, blood tests can detect hormone imbalances or vitamin deficiencies, which can also cause cognitive issues. However, the most important diagnostic tools are brain imaging techniques. CT, computed tomography, and MRI, magnetic resonance imaging, help visualize structural changes in the brain. With LBD, specific regions responsible for thinking, movement, and perception are affected. In some cases, PET scans, positron emission tomography, are used to assess neuron activity. Another valuable method is sleep studies. Polysomnography can detect REM sleep disturbances, which are common in LBD. If someone moves, flails their arms, or talks in their sleep, this can be a strong diagnostic clue. Because of its complex symptoms, LBD is often misdiagnosed as Alzheimer's or Parkinson's. For instance, if a doctor only notices cognitive issues, they might mistakenly diagnose Alzheimer's. And if movement problems are more prominent, they might diagnose Parkinson's instead. That's why it's so important to look at the full range of symptoms. Do you or a loved one have symptoms that resemble LBD? Share your experience in the comments. Your stories could help others recognize warning signs and seek medical attention in time. Now let's talk about the available treatment options and how effective they are. Unfortunately, there is currently no cure that can completely stop or reverse Lewy body dementia. However, modern treatments can help manage symptoms and improve a patient's quality of life. The first step in treatment is using medications that support cognitive function. Doctors often prescribe acetylcholinesterase inhibitors, such as donepezil, rivastigmine, and galantamine. These drugs boost levels of acetylcholine, a neurotransmitter that helps nerve cells communicate. For LBD patients, these medications can not only slow cognitive decline, but also reduce the severity of hallucinations. To help with movement issues, doctors sometimes prescribe Parkinson's medications like levodopa, but these need to be used with caution. LBD patients can experience increased confusion and severe side effects. That's why these drugs are prescribed at the lowest possible doses and only under close medical supervision. One of the most challenging symptoms of LBD is hallucinations and psychotic episodes. Many patients see things that aren't there or hear voices, which can be frightening and disorienting. It may seem logical to prescribe antipsychotic medications, but this can be extremely dangerous. Traditional antipsychotics like haloperidol can severely worsen the patient's condition. They can cause extreme confusion, severe muscle rigidity, and even life-threatening complications. Doctors only use atypical antipsychotics, such as quetiapine, and only in extreme cases when hallucinations become a serious threat. Mood-stabilizing medications also play an important role in treatment. If a patient experiences severe anxiety, depression, or apathy, doctors may prescribe antidepressants like sertraline or escitalopram. Treating LBD requires a personalized approach and continuous medical supervision. It's crucial to avoid self-medicating and to carefully monitor how the body responds to medications. But medication is only part of the treatment. Next, we'll explore alternative approaches that can help manage symptoms and support patients in daily life. Medications can help manage the symptoms of Lewy body dementia, but they can't stop the disease from progressing. That's why non-drug therapies play a crucial role in slowing decline and improving a patient's quality of life. One of the most effective approaches is music therapy. Music stimulates areas of the brain linked to emotions and memory. Even if a person forgets words, familiar melodies can trigger memories and bring positive emotions. Listening to favorite songs can help reduce anxiety and improve mood. Art therapy is also highly beneficial. Activities like drawing, sculpting, or even simple coloring allow patients to express emotions, relieve stress, and focus on an enjoyable process. For maintaining mobility, gentle massage and light exercise can be very helpful. Massage relaxes muscles, improves circulation, and helps relieve tension caused by movement difficulties. Simple stretching and coordination exercises help maintain flexibility and prevent complications from prolonged inactivity. Regular physical activity is also essential. Even short walks outside can improve well-being, reduce fall risk, and strengthen muscles. If independent movement is difficult, seated exercises or assisted movement activities can be beneficial. These alternative therapies don't replace medication, but they help patients stay active longer and maintain emotional balance. Now let's talk about how to properly care for someone with LBD and explore strategies that can make daily life easier for both the patient and their loved ones. Lewy body dementia doesn't just change the life of the person diagnosed, it also presents serious challenges for their loved ones. Proper caregiving can help reduce stress, maintain comfort, and ensure the person's safety. The first step is creating a supportive environment. It's important to minimize potential stressors. Loud noises, bright lights, or a cluttered space. The environment should feel predictable and safe. For example, removing tripping hazards can help prevent falls. Adding clear visual cues such as large number clocks, calendars, and reminders can also provide helpful orientation. One of the most challenging symptoms of LBD is hallucinations. If a person sees or hears something that isn't real, the key is not to argue or try to convince them otherwise. Instead, gently redirect their attention to something else. For example, if they believe a stranger is in the room, you might suggest going to the kitchen for tea or shifting the conversation to a comforting memory. Communication is also crucial. It's best to speak calmly using short and simple sentences. Ask easy questions that can be answered with yes or no. If they seem confused, offering two choices can help them feel more in control. Maintaining eye contact, using a friendly tone, and incorporating gentle gestures can improve understanding. If they struggle to find words, don't rush or correct them. Just give them time or help them express their thoughts. Reducing stress is another key factor. Sudden changes can cause anxiety, so keeping a stable daily routine is essential. Simple rituals like daily walks, meal times, and rest periods should happen at the same time each day. Caring for someone with LBD requires patience and understanding. It's not just about assisting with daily tasks. It's about providing emotional support as well. Today, we took an in-depth look at Lewy body dementia, what it is, why it happens, and how to distinguish it from other types of dementia. We covered its symptoms, stages of progression, diagnostic methods, modern treatment approaches, and alternative ways to support patients. We also discussed the importance of proper caregiving and creating a comfortable environment for someone with LBD. Yes, as of now, there is no cure for Lewy body dementia, but that doesn't mean there's nothing we can do. Early detection, well-managed therapy, and attentive care can slow the disease's progression and greatly improve a patient's quality of life. The key is not to ignore the early warning signs. If you or a loved one are experiencing changes in attention, movement, or perception, don't delay seeking medical advice. Timely diagnosis can make a huge difference in how the disease unfolds. And remember, a person with LBD is still a person, someone who needs understanding and compassion. Your patience, support, and kindness can have a meaningful impact on their well-being. Did you find this video helpful? If so, please give it a like and subscribe to the channel. I truly appreciate it. It means a lot to me. And now, I invite you to watch the next video. I'm sure you'll find it just as interesting. Thank you for watching until the end. Take care, and I'll see you in the next video.